Hello and good day to you from wherever you are watching this. You are welcome to the Unpack It podcast, a podcast where we have conversations around your mental well being in ensuring that you are good. We'll talk about how it affects your immediate family, society, and the world at large. Alright, my name is Ayola Akinwumi, but just call me Akiayo. And today, to unpack our conversations, I have amazing guests with me to discuss and really get the juice out of this today. And to my left, ladies first. I hope you're fine with that.
Absolutely.
Ladies first. So to my left, I have with me a very fantastic Dr. Chinaza. How are you today?
I'm fine, thank you.
Dr. Chinaza is fine, right? Is that correct?
I'm fine.
Okay, so Dr. Chinaza is a clinical psychologist. Well, let me allow you to introduce yourself.
Okay. I am Chinaza Ugoke. I'm a clinical psychologist at FMC Jabi, Federal Medical Center Jabi.
Javi, okay, lovely, Federal Medical Center, and you're a clinical psychologist
Yes.
with them.
I work at the mental health unit.
Lovely, and yeah, you've probably seen Dr. Hope before. And this is Dr. Hope once again, who is a founder of the Vigada. Yeah, it's a foundation that combats drug use and misuse as well, substance misuse. Very quick game. It's not hard though. It's something very simple. I saw something online. A guy was talking about how do you introduce yourself without the titles. So who should I start with? So who is Doctor Who without Doctor Who without the title?
Supportive hope Omega.
Okay, that's good. Supporting Hope Omega. And what would you introduce about? Or who would you say Chinaza is without the title?
Without the title, like the job attached, like
Without the job, without school, without office, like who are you really like?
okay. It's quite hard. Like a one-word answer.
No, it's not
Okay,
about
so
anything.
trying to make people's difficult situations better.
Someone that is hi, I am Chinaza. I just want to make difficult situations better. Right?
Yeah.
Makes sense. Because me, I was prepared something like, "Hi guys, I'm Ayo." Because my name is Ayo, and that means joy.
Okay.
I'm somebody that is full with joy, and I just want everybody around me to be happy. Yeah, makes sense, but
Amazing.
You should have gone first. It's giving a hint.
it's
like-
giving a hint, right? Okay. Anyways, welcome once again. Thank you for being on Unpack It podcast, and we'll be looking at. I mean, you are with the Federal Medical Center, the mental health unit. Dr. Hope is, he's on a private level. He has a foundation, two, right? I'm not mistaken.
Rehab centers.
Okay, two rehab centers, yes,
And of course the foundation.
and a foundation, yes. So two rehab centers that help, with handling things. I would want to, we're discussing in alignment with the World Mental Health Day, with the theme access to services, mental health in catastrophes and emergencies. God has helped us. We are not so in so much of catastrophes in Nigeria, right? We don't have a lot in Nigeria, but yes, we have a little. But so, just to help contextualize or into what we are dealing with exactly, so we're going to be looking as it concerns Nigeria. So from a public eye view is where we have you, and from a private eye view is where we have Dr. Hope, right? So let's start with this. What do you think is the current state of mental health in Nigeria?
Okay. The current state of mental health in Nigeria is better than it was 10 years ago. That is one thing I can say for sure. So there's more awareness, even though there's a long way to go. But years back, I don't think it was as popularized as it is now. Even now people stigmatize with mental health. Like someone will be referred from the GOPD to come to mental health units to see the psychiatrist, and they will refuse to come because they do not want to be associated with that whole tag. You understand?
Interesting.
but it is still better than it was a few years ago.
Oh, lovely,
Yeah.
lovely. I
So
mean,
that is
you've
what I
touched
the
on a few
condition of
things, but
uh-huh.
let's take it gradually. So I know Dr. Hope, we've explained this before in previous episodes, but we looked at the statistics and we said is mental health issues on the rise. Now you said it's better because there's better
I
awareness,
mean, yeah, awareness. I'm not
not
talking
in terms
about
of the situation.
yes,
So
not in terms
because
of the condition.
statistically, we say that there is a increase in mental health challenges in Nigeria compared to the other years.
Yeah, I'm tempted to agree that we do have an increase in the prevalence of those suffering mental illnesses because, of course, the rise in crisis, the rise in economic hardship,
Mm-hmm.
the rise in other non-favorable conditions that are peculiar to human beings, right?
Yes.
So all of this tends to put stress on the minds of human beings. So yeah, like I said, I'm tempted to agree that yeah, we do have a rise. Again, we must also note that there is the increase in awareness of mental health would also account for the rise in numbers because people are becoming more aware, that oh, I have a mental problem. In fact, like she said, 10 years ago, probably we may not be able to have this conversation.
True.
Right? Okay.
True.
But you can see people now come in and talk to you. I think I saw someone in the room earlier who mentioned he's an overcomer of addiction. Okay, maybe 10 years ago, that person may not be able to come out and say, you know what, I used to. Right.
Do drugs,
Okay.
yeah.
And there are people now who call in to your head to the helpline of I Choose Life Foundation and seek help. Maybe 10 years ago, right? They may not be able to do that. Yeah, but because of the increase in awareness on not just the condition of mental illnesses or mental illness, but also on the available help. Okay, so they are able. Now she just touched on the utility of even the scarce commodity psychiatrist, where a patient is referred to see a psychiatrist, and he is being referred, and the psychiatrist is there to see, but because of the time, how what people say, they would not go and see
into
a
into the
psychiatrist.
psychiatrist. Yeah, I think that's a very beautiful perspective, and let's still dwell on that. But let me refer to you now. What do you think is the reason as to why people can we? Yeah, we already mentioned the tag, but can we expatiate? Can we delve deeper into what are the resistance, right? What causes the resistance for people to seek this help? And what are we doing, or what can we do in ensuring that that resistance is brought to the barest minimum?
Okay. The resistance for people wanting to seek help, one of them, well, definitely stigma, cultural notations of mental health. Some cultures believe that a person, when you think of mental health for a layman, the first thing that comes to your head is the madman of the road.
Yeah.
And in movies, what
Always.
is that the punishment for? It's because you did something wrong. That is why you're mad. So people do
Okay.
not want to be associated with such a tag. And then for some cultures, like in my culture, where when there's this Ijo essay where people ask around about your family, and then people will be like, this will have madness in their family. You understand? So people do not want to be associated with that madness, mental health, and that is why I believe a lot of people are resistant to talk about it, to want to seek help, because they don't want to be associated with that person on the road. But then people do not know that mental health is a range of, there's no madness in DSM, there's no madness in ICD. So there's depression, there's anxiety, there's postpartum issues, there's schizophrenia, but there's no madness. And people are not aware from, I don't know how young you are when you heard about psychology and psychological disorders.
Like some 5 years ago.
So it's not taught about, like, even doing career day where people, I think the closest I've come to mental health was when I was in senior secondary. There was a psychiatrist, he came for the career day, and then one of the panelists was like, they act like they're patients. So even healthcare providers are facing stigma. So imagine a patient, no one wants to be associated with
Even the
such.
healthcare provider is facing stigma. How
Yes,
much more?
patients.
So wow, that's interesting. So it means that there is a lot of education that needs to go
A
into
lot
this.
of education needs to
Let
go
me
into
let me
it.
paint a scenario. While I was in, I think, JSS 3, that's junior secondary school,
Mm-hmm.
class 3, we had this excursion. So we went to Abeokuta. We went to see the Oluma Rock, and then from there we went to there's a federal psychiatric hospital in Abeokuta, and we went there to see. I think that was my first um, experience with people that done drugs and all that. But at that point, it was extreme. We could all I could see was the extreme part of it. Like they had to change some guys,
Mm-hmm.
so because of maybe the withdrawal symptoms from the drugs and all of that. That was just the extreme level of it. We didn't have the ground level or ground basis. So now that we understand these things, now that we see the barriers, yeah, what are like practical steps that we can take to ensure that, I mean, I was in JSS 3 when I heard about psychiatry. First, I was like, that was my first contact with that. I can vividly remember. What are the steps we have to take, right, to further open the eyes of people to see these things, to understand, so that the access that we seek, because it is a all-round thing, right? Everybody's involved. Like we already mentioned earlier, too, that if there is no demand, there is no supply,
Supply.
right? So even so that the healthcare guy givers are not being stigmatized,
Mm-hmm.
so that the people that want to go for the therapy are not being. So what are practical steps that we should take in ensuring that this access becomes a regular thing for everybody to tap into? Let me go, Dr. Hope.
Yeah, I think Dr. Chinaza has highlighted some already, in the course of our contribution. We must begin to let younger people, the toddlers growing up in school, they must begin to see mental health as a profession. Okay, not for people who applied for medicine and did not get it and they gave them psychology. No, I studied
Yeah.
medicine, right? So and then of course among my MSCs I have MSc in clinical psychology, right? And I will tell you that it's even making more sense to me than the public health MSc I had.
Wow.
All right, so where many people are rushing into MSc public health because they are eyeing one NGO job, right? So, but they forget that clinical psychology has a lot of prospects. You can work almost everywhere. This is not trying to psych them. So we must begin to see psychology as a profession. And one area that has not been broached, even though it's not part of this conversation, is forensic psychology. Right? We have a forensic psychology, I guess that maybe in the next episode, right? Now, so what I'm saying is we must begin to let younger people understand that there is prospect in psychology. There is a demand, and this demand is massive, right? So that's one. Then secondly, we must begin to educate to change the perception of people who practice this profession. Just like she said, you know, the same thing. Even as a medical doctor, I mean, as a medical student, when we went for our posting in psychiatry, there's one very brilliant psychiatrist. They say he dressed in one way, the suit is down, it's upside down, something like that, right? So now, and unfortunately, you see, the thing is, if I come now and you dress that way, I'm not saying because you're a psychiatrist. If you come to, it's just the person's personality, perhaps,
Right.
to not care about how he looks, isn't it? So if I come now and I see Mr. Timmy, wearing tie, wearing a tie, I just assume maybe everybody here wear tie, So, but
Yeah.
it doesn't really connote what the situation is. Yeah, so it still comes to the stigma, all right, and then beyond even the stigma, these people suffer prejudices that even further deter them from practice. All right. So we talked about motivation earlier, right? So if look at it, even look. Let me use church as an example. Or have you ever seen a minister of the gospel tell you, "I am teacher Robert"? No, it's apostle prophet. You rarely see someone say, "I'm teacher." So you see, people don't take titles that they perceive is not glorified. So we must change the narrative, all right? So I think that is it's going to be very practical in helping people. Then of course awareness and sensitization. We must differentiate between sensitization and awareness. Sensitization is geared towards policymakers, people that have the capacity to make policies. Awareness is for people who do not have the capacity to make policies. All right. So what you can do for general Nigerian population is, you know what, be aware that this is this is this. But sensitization goes to people who have the capacity to formulate policies and implement policies. All right. So you see, if we don't channel the energy towards the right way, I mean, we'll be missing out. So let's practically, like you said, career day, counseling in school, you know, for younger people who are in school to see mental health as a profession to practice. They must see the prospect in mental health, right? And then, of course, awareness, you know, on what mental health is, what addiction is, what depression is. You know, Dr. Chino that was almost hitting something I mentioned in the last episode about mental health being a continuum. You know, so she said it's a range. So that's it. So there's nothing like this person is mad. You know, so in other words, in fact, if you ask me, we are all mad at different levels.
Right.
Right? Okay, so we must begin to educate people. And again, we must tell people it could be you.
Yeah.
Yes.
Do you understand?
Yes.
Now, so the same thing goes for those who suffer drug addiction. Just like you said, people see those who go to see a psychiatrist, oh, it's punishment for something you have done to the gods, or you have done something wrong in your family or something. Now the same thing too, we are saying and advocating that addiction is not punishment for taking drugs. I don't know if you get it. Okay, what has somebody who has a chronic illness like diabetes and hypertension, what will he say he has done to make him have diabetes? And these are chronic illnesses. So the same thing to rehabilitation is not punishment for wrongdoing. You know why? Statistics has it that 10 to 15% of those who use substances have problems with the substance or suffer addiction. What does that mean? It means a larger number of 85 to 90% will use a substance or use substances and never have a problem with stopping or with how he uses the substance. So you can have, many of us here probably have a friend who does or use substances, but then the guy can say, he will go to work, it doesn't affect his functionality. You know, maybe we want to talk about personality disorder and other issues or mental health. We can now see that when these things are able to affect your functionality, your activity, and then when it is significantly in deviation from societal norms. Do you understand? So that people don't just go around and just look at someone and say, he's depressed. You know, now depression is being so used that it's becoming a stigma word.
Yeah.
You understand?
Yeah.
In the event of trying to create awareness, we're now turning it again to stigmatize people.
Stigmatization,
So
yeah.
now you're really depressed.
So in my age category, right, you see the older generation say things like small thing, my mental health too, my mental health too, my mental health too. Hey, Dr. Hope, you've just triggered something that can
Kill it.
I understand that people are beginning to pick it up in certain ways that they're not supposed to do it. But we also need to be sure, or we also need to agree that these things are actually true. Like, I'm in an office that seems quite demanding and stuff. It's probably affecting my mental health. So at what point do you now begin to differentiate, just to help the guests, right? Because we are saying that people are now beginning to overuse it. So how do I put this now? The question to help. How can we inform the people to make them understand that, see, this is when this issue is. Don't just say I'm depressed. This is how you can say depressed. Okay, this is the line. Or how do you draw the line to say that, oh, it's affecting your mental health? Or this is a matter of you just need to be more resilient at work. Do you get my question?
No, you are calling work. You know, mental health is a large space. You know, because there's what we call burnout. You know? Right. So you see, somebody can be sad at work and it's not depression. It's only suffering a burnout.
Burnout, yeah.
And it's a psychological disorder. Do you understand now, right? Okay, so when you say, oh, I'm depressed, it's not when you are feeling sad. Some people, they are feeling sad, but they say they are depressed. So depression is when this person feels sad or empty most hours of the day.
Mm.
And then, in fact, the next day, continuously for about 2 to 3 weeks.
That's when you.
And then, yeah, so that may, the fact that it's not 3 weeks yet does not mean it's not a cause for concern. Which is why when we are talking about, okay, when do you seek for help, when you start feeling sad, talk to someone you trust, right? Now, so you see, but you can't say this person is depressed, diagnosis depression, no. Do you understand? In fact, even in that, there's also constitutional depression. The person is broke, and then he's depressed for 5 days because he's broke. Situational. If you give him money,
Let money go in my account. Energy.
do you understand? Like when we came to Lagos at
Yes.
Iwaya community,
Yaba
when we
community,
did
yes.
for postpartum depression with our Choose Life Foundation, right? Some of those women we had, they were applied questionnaires, the EPDS questionnaire, Edinburgh postpartum depression scale, right? Some of them were situational because they had nothing to eat. They were breastfeeding, had nothing to eat, no money.
Yes.
But I just brought partners that gave them power oil and rice. And then depression disappeared.
Depression disappeared.
Right? Okay, so you are depressed when you are sad and you feel empty or even hopeless. Or you feel a sense of impending doom, something bad's about to happen. And this thought, this feeling extends for most hours of the day. So much that it affects you, you couldn't deliver your daily task. Like I said, I defined mental health earlier. So if it affects you in a way that you can't learn well, you can't go to work productively, it affects you that, you cannot realize your capacity in that day. That means you can't deliver on your task on that day, either as house chores or office task. Or it affects you so much that, you could not give out or contribute to society. Then there's a challenge. So it means it's affecting your functionality. Then you need to begin to seek help. Right? Or you start thinking of having suicidal thoughts or negative, thoughts. You need to then, talk to someone.
Talk to someone. Yeah. Absolutely. I like that. Thank you for that bit of clarity to help. So just
Dr. Chinala may want to,
you want to add to that?
There's not much to add here. As hit on everything.
Really explained.
Is the duration for most diagnosis? Duration is very important.
Yeah.
A difference of 1 month can change a diagnosis completely.
Absolutely. Thank you very much for that or for that clarity. And I just want to touch a bit on statistics a bit and to see what the current state of things are in Nigeria. You might not be so specific in terms of knowing what, but what are like the prevalent issues that we face in Nigeria, right? In terms of mental health challenges, is it anxiety? Is it depression? Well, from your experiences at work on a daily, what is most prevalent to that you've seen?
The most prevalent I've seen is anxiety, followed by very closely by depression. It can be some months it's more depression than anxiety. Some there's more anxiety than depression, and most times depression is very anxiety is very. I think the distress for anxiety is a lot, and with depression, there's no energy, so even trouble getting out of bed. So for you to even get out of bed to seek help is a struggle. But with anxiety, there are some somatic symptoms that come along with anxiety. It's the headache, it's the crawling sensations. You have to run to the hospital at some point. So otherwise, why we see a lot of anxiety.
So would you say that? I was speaking to somebody and he was talking about how that the prevalence of these or the statistics might be from an economic point of view and all of that. Like, from you just said, you can tell largely that anxiety or these issues can largely come from our situations around. This is what's prevalent in Nigeria, right? This is what we're facing. This is what can we tie these things to? Like, definitely everything has a root. Can you help in trying to help us understand the situation of things around that?
Okay, so anybody in Nigeria is aware of Nigeria is very tough. I think internationally everywhere is tough. So Yes, I think you can tie the situation of Nigeria. If it's not tax increasing, it's fuel scarcity, there's always something going on, always bad news in Nigeria. So yes, I think you can tie it to some because you already have your own personal problems. It could be family problems, and then with the increase of the problem, the nationwide problem, it affects as well because everyone, there are risk factors mental health like genetics, life experiences, and so these experiences contribute very greatly to mental health issues.
Interesting. Thank you for that. I mean, economy is very important, and I mean, just to show that we have a huge gap or a
Mm-hmm.
huge space to cover and all of that. And also, interestingly, another aspect I would like to us for us to touch on is in directions of the services that are rendered around mental health. Yeah. So for a daily Nigerian watching this that has not visited the clinic before or had to do anything with, either public or private therapy or whatnot, what is it like to visit the clinic to seek for a therapy? So I've listened to this podcast now. I enjoyed it and I've gotten educated about one or two, and I would like to then further. So, what is it like, a daily activity like, to see a doctor?
So anybody who knows a public hospital knows that you have to dedicate your day. It is a long. So for us, for initial assessment, it is advised to go through the GOPD unless you get a referral from a different hospital.
What's the meaning of GOPD?
The general outpatient department. So when you go to the hospital, those are the first people you see. So you go to Federal Medical Center, you get your card, you go to the cash point, you see the general doctor and lay your complaint. Then if referred to you will be referred to the mental health problem if it's a mental health issue. If not, because some you can run some tests like hyperthyroidism can come can show the same symptoms as anxiety. So that is why we would like you to go through the
Sorry to cut you. All
Okay.
right. So, for the sake of those that don't understand what it
Okay.
is, what's the meaning of hyperthyroidism?
Hyperthyroidism is a physical illness, not necessarily.
Okay.
So yes, so the thyroid.
Yeah. Okay.
So the hyperthyroidism comes with some symptoms like breathlessness, sweating, the palpitation. These are some things that you also see in anxiety. So that
Yeah.
is why we prefer you actually go through the general doctor so that you are screened from any other thing that could be causing this mental health symptoms.
Wow.
Yes.
You see what you just explained right now speaks to the importance of why you should not label yourself
Yes.
or give yourself diagnosis, right? Just
Mhm.
say, I went to ChatGPT and ChatGPT said, I have anxiety. Whereas you're probably dealing with something else entirely.
Yes.
So, I mean, lovely. Thank you for that.
Mhm.
So, just to continue, you were giving us
Mhm.
like what it feels like to see a doctor.
Okay.
Yeah.
So when you're referred to the mental health unit, then you're seen by the psychiatrist. Yes. So it's the psychiatrist that assesses you and assesses the severity, whether you will do well on just psychotherapy, whether you'll be needing a mixture of both psychotherapy and medication, or whether you need medication. So after being assessed by the psychiatrist, that is when you are referred to the psychotherapist.
Interesting. I mean, that's a very interesting process.
Yes.
But I hope I will not be too biased to say that some of these things can cause people just saying, "Let me just be on my own."
Exactly.
So, what
Exactly.
are the what can we say that the medical center or the federal ministry is working towards in ensuring that that limitation is bridged? Yeah, that gap is bridged because I mean, I can easily go to like a Dr. Hope because
Mhm.
I don't have to queue, I don't have to buy a card, I don't have to do all of this. How is there anything that is being done in that direction?
I don't think there's much that can be done
Mm.
in that. Yes, if there are more specialists, yeah, more specialists would help a long way. But the GOPD, the mental health, these steps are quite vital. if you ask me, because I explained that you have to rule out physical, then the mental health, the psychiatrist sees and assesses, then move. And this psychiatrist seeing and looking for therapy actually helps us organize better. Because if you come to the mental health unit, like today, it is, I don't know when the clinic will end. So a lot of people, new patients, follow-up patients. So when they are assessed by the psychiatrist and they are given medication to help them stay stable until they can be seen by the psychotherapist, because you will not be seen that week by the psychotherapist.
Oh wow.
Yes.
So that okay, that
Yes.
speaks to the depth of, should I say depth, or speaks to the real gap we have
Mhm.
in terms of ratio
Yes,
of
of
the doctors
specialists
or the
and
specialists to
Mhm.
the yeah. Please just go ahead.
Yes. So that is the major problem. They are limited specialists. If there were enough people, enough hands on deck, this would be, even if you're seeing three people, it will seem very seamless
Mm.
to just, oh, this is. And another thing about mental health assessment, you cannot just do a test, so it takes a while. So you're spending about an hour, because you can't just do blood test and detect. You have to ask questions and ask questions until you find what is going on, what's wrong. Especially as people do not even know a lot about mental health. You just see someone, I don't know why they referred me here, I just said that I cannot sleep. I've not slept, I don't know why they sent me here. I don't have any mental issue. So first you have to calm them down and psychoeducate them about mental health before they can, then you have to start asking questions. How is your mood? How is your energy? So you're seeing yourself running through like uh, three disorders. You have to test for, you have to ask questions to identify depression, anxiety, schizophrenia. So that takes a while. But then we have to do it, because you cannot use a blood test to find these things out. So yes, we need a lot of hands. And yes, that's
Absolutely, I mean, you've spoken quite a lot on that, and I would like to take from both ends. Yeah. First, let me put it out that I think we're open now for questions. You can ask questions if you have any, just signify. But I'd also like to very quickly, what is the costing like, right, at the very basic minimal level, right? Maybe from a private sector. Is it free? Is it paid for? If it's paid for, what's it like? On the public end, definitely some things are paid for. I'm more even talking of drugs now. I'm just saying basic consultations. Let's just talk to somebody and all of that. What's the costing like? Because I know that costs affordability is one of the major challenges that Nigerians face. For us to be able to get this, to this point of for you to be able to get somebody to attend to you, or why they will shy away from mental health matters because they feel it's too expensive, it's too this, and how can we solve that problem by limiting it? So this way insurance then comes in. What your take? Do you think there are insurance for? Are there? I'm in the office, and my office insurance policy is only showing me that all I can treat is malaria. So can we speak in that direction? So both from the private sector angle or private eye, and then yeah, from the public side. Let's start with the two.
Well, for us, we over time have had some high-end patients who work with, UN, other very paying organizations, and then that also means that their insurance level can be a bit premium.
Okay.
So and they cover for the fees of their wards. I mean their staff. So that's a form of insurance for them. I mean they pay 100%. Right. So we've also had people having to pay out of pocket. And say for consultation, if it's on the NGO level, for what I Choose Life is doing, it's completely free. We've had patients escalated from, in fact, they call the initial consultation or medical first aid that the call respondent give to the caller is free, and then he eventually or she eventually gets referred to an expert, again at no cost. In fact, for some who can't even afford or who are away for distance, we arrange virtual sessions for them. I mentioned earlier in an episode where an individual had about 7 sessions with our psychologist for about 7 weeks, all at no cost, right? right? So that is achievable, that's possible, which is, these are some of the gaps that I Choose Life is filling, in the mental health access, care access, right? So, and then, but yeah, for those who can afford, all right, we have people paying as much as say 600,000 naira, covering both feeding 3 times daily. I mean, for those who have to be
In the rare.
institutionalized, who have to
Okay.
be admitted. Now, when you say sometimes rehab, it makes it look like it's just drug, drug, drug. No, all right. I've advocated too that drug addiction is a mental illness. In fact, the definition alone says that it's a chronic brain relapsing disease. That means it's a chronic brain relapsing disease. That's what addiction is, right? It's a mental illness, and sometimes they go hand in hand. Some people use drugs because of mental illness. Some develop mental illness because of drugs, right? So
Yes.
I had a young boy who took to codeine after his SS3 because he failed WAEC. Parents were always coding him. Look at your elder brother; they were comparing him.
Hmm.
And then he got into school, wasn't doing too well, and the friend said, "See, you are always bothered. Take this stuff, you'll be okay." He took really, and he was okay. But he eventually told me, he said, "My friend betrayed me. He didn't tell me that this would lead me here.
Hmm.
He only said that it will make me okay, but never said that it will lead me to a rehab." In fact, your friend, for those watching, your friend who is saying, "Do this, you'll be okay," is not aware
Yes.
that it can even lead you to somewhere that is not envisaged.
Hmm.
Right? Okay, so you see that now. Right? So that means the inability of the young boy to be able to communicate, all right, to solve his prolonged sadness about his family's verbal scoldings, right, led to his use of substance. All right. So which is why again I would advocate that mental health should be stepped down to even primary schools. Right. We must teach our young people how to cope with stress, how to solve problems, how to communicate. Right. Social skills. It's not just enough to teach them maths and English. All right. But we must teach them. You see why I still keep saying that psychology is a profession on its own. Right. So you must teach young people how to manage life, how to be self-confident, how to how to be able to stand for his or herself, how to know personal space
Hmm.
and boundaries. All of these are important, right? So if you look at that, you realize that, not mind me, there's so much to say. You realize that there's a lot to do in the facility for the person, right? It's not just the person who is using drug that we admit, all right? So the person who is using drug probably has a mental illness. The person who is having mental illness primarily probably was because of a drug he used. He's no longer using the drug, but he has a mental illness. We have seen those cases too. We also have dual diagnosis. Okay, when he has both drug and mental illness. All right. So what you have, so the treatment covers all of that, both medications and these drugs. Some of them are not cheap. You know, So and then of course you have to. It covers both sessions with the psychiatrist.
Hmm.
We, like she said, she was talking about GOPD that affords you to see a general practitioner first, that gives a general outlook of your problem. It takes a proper clicking of you. Like she was talking about hyperthyroidism. The thyroid gland secretes hormones called thyroxine,
Yeah.
right? And these hormones aids your body function. And when it's high, it causes problems for you. It can make
Hmm.
your heartbeat to be higher. It can even cause some people can have hypertension, and it's not because of any hypertension, but because of the high hormone, right? So they can be sweating, bulging eyes. If he eats now, he wants to eat again. But there's hypermetabolism, for hyperthyroidism. So and then sweaty palms and all of that.
Yeah.
Now, which are also signs of anxiety. So you can come to the clinic and then they will just say it's anxiety, and it's not anxiety. He actually has hyperthyroidism. All right, so which is why a doctor should see, a general practitioner should see, because the psychiatrist at that level, when he's seeing you, he wants to narrow, right? He wants to narrow. He's a specialist. It's not as if he's trying to be irresponsible. No, he is a specialist. He is expected that you, a doctor, a medical officer, has seen, and then give him possible diagnosis of what it, and even done some tests that can inform the consultant. You see that now. So, for example, I'm a medical doctor, so I see my patient, for example, before the consultant psychiatrist sees the patient. And of course, the clinical psychologists have also seen in our center, so that there's a full clinic, family, whatever. We may have even invited a family member to give more history about the patient before the consultant comes, so that when he comes, he takes summary, and so he's able to give, so he doesn't waste all the time, trying to ask all the questions that has been asked already, so and then that care is there, right? So these are the things that is obtainable in our own center, and is obtainable in other rehab centers, at least that are specialist centers that I know. I'm not talking about the other malam, whatever one, or when they type, because the picture of rehabilitation is this, that the media has sold to people, is that, you picture a facility where people have flies passing over them, and not no self-care routine, and then probably lying on the ground, bare floor, dirty looking, and all of that. No, but it's a facility where you have programs laid out for them daily, from devotions, group therapy sessions, individual sessions, sport and exercise time. You understand my point? So and then they have nurses, experts attending to them, right? So which is obtainable in the FMC Jabi, for example, but maybe they may not also have maybe an admission ward or something, or a rehab center, so to say.
We have a building, but it has not yet been open.
Yeah.
So we have the building and the chairs, but not.
Well, you can donate to just.
Yeah.
Let's help.
So we are yet to start utilizing it, but we admit. But we can't admit
short-term admissions.
Yes, short-term, because they are in the same ward with other people who are going through medical issues.
Other medical
so
issues.
Usually when the person is disruptive, we are able to get private rooms at the hospital. But when it's something like depression and the person cannot afford these private rooms, they can be in the general ward. But once it's psychosis, the person is admitted into a private ward.
A private ward. Okay,
Yes.
so I like that we've gone through the different levels from the intermediate to to what might be the extreme level at the most chronic, and it just speaks to the fact that there are systems actually in Nigeria to assess these things or to touch on these problems that we have. We just need more awareness, more education to the people, which you've also already mentioned that is a key thing for us to engage in. Mental health challenges is not a bad thing, right? All you just have to do is ensure that you have the right access or the right channel to ensure that you are good, and before it becomes something that becomes bad. I don't know how to put it. So a lecturer once told me when I was doing research, my research class, he said that dropping a nylon or a sachet of water on the floor is not bad at the time. Where it becomes bad is when it becomes flooded in the environment. You know that's the problem. So the fact that there is a dent right now does not cause the problem yet, but it has a very huge potential to cause a problem. So we understand these things, and I hope that our viewers are able to learn one or two and understand that it might not be the same way media is portraying it to you, right? People are just putting out stories. The systems are there. The structures are in place. All we just need to do is support the structures and get the right education to it. And I think one key other thing that was highlighted across the both when both of you were speaking is in terms of diagnosis. Yeah, don't just diagnose yourself. I see a lot of people do those things. Yeah, I think I have ADHD. I get OCD. I have this. Like you're just saying. But from what both of you are just saying right now, a minimum of at least 1 week under constant supervision before they can say you have this. And you see the amount of people you have to see before you can, say that I have this. So he has explained to us situational depression, where, the 5K that your account now, depression don't go, depression has gone. So I hope that from this latest section, you're able to understand that we're trying actually, we're doing a lot in Nigeria, we are doing a number of things, and I hope that you're able to learn, you're able to reach out to people when you need to reach out to people. We have the private sectors, the NGOs like the I Choose Life Foundation, the Vigada, people like Dr. O that can reach out to you at little to no cost. Then we have the okay, settle maybe not, but what I mean is time, right?
That's the general rule.
General. All right, okay. You have something to say? A question, all right.
So I wanted to ask you, so for a mental survival like me,
Okay.
So for a mental health worker like me, getting access to drugs by dispensing. Yeah. So I wanted to know, is there anything the government is doing about it, like to, I don't know, subsidize this, yeah, this
Mhm.
type of getting access to drugs and all, because they are quite expensive. Like,
And it is a very big problem because there was a patient that came the other day. He's schizophrenic
Mm.
and he has drugs prescribed, but in order to, because he's a retired person, he doesn't have a lot of money. So you see him spacing the drugs, and that is not going to bring about the effects that. So what some patients do is they help and they get it's like we have some medications for the less privileged. We can, the patients would donate the medications and we can help the less privileged. But for the government, our hospital has a social welfare as well that also supports, but for the government, there is nothing concrete.
Yeah,
Okay, yeah, sure.
I think for the government, I mean, you've already mentioned what individuals are doing,
Mhm.
you know, to assist those who are in their shoes and can't afford, right? So I think the government should look at expanding the scale or the scope of the health insurance,
Mm-hmm.
all right, to see how uh, mostly used antipsychotics are
Yes.
incorporated or included,
Yes.
right, in the insurance scheme, you know, so that if I have an insurance, I mean, and I have mental illness, the same way I have access to antihypertensives for my insurance, which is a chronic illness, I should also have access to antipsychotics for my mental health illness that is also chronic. So you see, that says that even the stigma you're talking about starts from
Yes.
somewhere very systemic, and it has to you have to address it. Really.
I love that. Okay, I know that there we have a mental health Act 2021, and interesting. I might not be able to, delve deep into it, but I was speaking to someone, and she was like, "Do you know that a lot of these things are actually provided?" Okay, maybe we'll probably have another section where we, talk more on this precisely because.
Iola, it's implementation.
Mm-hmm. Yes.
Do you understand? Now, another government may come and for whatever reason decide to discard what this government has done without implementing what that government has done and spend budget again on policy formulation and then come out with documents that will remain in the archives. Right? So, but how do we implement?
Yeah.
We must then budgetary prioritization. We must prioritize. So that's why I mentioned earlier awareness and sensitization. And I differentiated that awareness is for people like us who probably do not have the capacity to change policy, make policy, and implement policy. So, but sensitization is for those in the National Assembly, the legislatures. Those in the executive arm of government, I need to give assent to certain prescriptions, right, to policies. And then, of course, those in the various ministries who should implement, who are the foot soldiers of the government that should implement this. So it's not only tax reforms that we should be hard on implementing. We should also be able to be hard on implementing policies that concerns mental health. Do you get me? If you already have it in the act, implement it. As far as it's not implemented, the common man doesn't know. And as far as I'm concerned, it doesn't exist. It has to be implemented. Because you won't know that the tax, whatever, that maybe if they say you should start paying 1 million naira for having a camera now as tax, I agree. Now you won't know until one day you hold your guy and say, come and pay your tax. Or now then it's implemented.
Okay, that's implementation. I think that's very, very solid. And so I hope we'll be able to answer the question in terms of subsidization comes having your drug subsidized or medication subsidized is yeah,
Yes.
in different categories on how it works basically. And organizations like the Achieve Life Foundation, do things like that. I know of someone that are committed to his drugs for I don't know when, for as long as the organization can handle it and stuff. So again, to help with that, I think this is where the organizations like I Choose Life now calls for partnerships, sponsorships. You might not want to go in the direction of people that are sharing food. Yeah, because people will say, "Oh, you want to do charity? Let's just donate here." Yeah, other means that you can donate, other directions that you can donate, and let's just create more awareness about it because it's important and very necessary so that we can have a wholesome community at large, and then our community grows and we blossom as the flowers or as the sunflowers, basically, as it's supposed to. But anyways, I think we've had a very
Let me ask
impactful conversation. Okay.
you. Yeah, a very simple and direct one. Dr. Chinas, thank you. Okay. How much do you think the common Nigeria believe in the government policy of health insurance?
The last time I used my health insurance to purchase a malaria drug, the malaria drug made me throw up and I had to get another one. So, because the amount of money I feel that is given and the way it is structured, for me, I don't believe a lot in it, in the national health insurance scheme. But I feel like it's something that can be improved. Right now, it is not at its best. I like the idea is beautiful, but it's not at its best. There's a lot of room for growth.
Mm.
So,
I think on my own end, I believe in it because
Mhm.
I've benefited from it.
okay.
I've used it while I was a student in
Okay.
all my days in the university.
Mm-hmm.
Anytime I went to the medical center, I always got my drugs for free,
Mm-hmm.
right? So it works, right? And I think we just, like you said,
Mhm.
just need to improve it basically.
Yes.
And then in relation to mental health, as we have said, we just need to further improve and request. So there are times wherein the whole system wasn't working as well. We had a system to report
Mhm.
wherein they can hold them accountable to ensure that what they need to do is being done by, I mean, there's a structure in the school. And I think those are the same things that we're talking about. Nigerians needs, or you that are watching right now, not just Nigerian, yeah, or Nigerian because we are in Nigeria, yeah. So Nigerians need to hold accountable systems that are in place. So you are being informed. It's a different case when you are not informed, when you don't know, like you already mentioned as well. So like it's a different ball game. But now that you are informed, now that you know, it is on you, right? Brings us back to all of these things we can say. But this is your own singular action to ensuring that this is achieved, that we have a good mental health. Now you have the information. So if you're somebody that is misbehaving randomly, you're not just going to be like, you want to check every levels before you pass your verdict, before you pass your judgment. And yeah, so just to call it a day. We've had a very amazing and interesting conversation. I'd like to say thank you once again to Dr. Hope and to Dr. Chinaza for being on this amazing conversation. And